welcome to the Get Healthcare podcast. We're going to look at understanding Ireland's healthcare system, and we'll be looking at some elements of public versus private healthcare with Dr. Nick Flynn, and he'll be answering some of my questions. So thanks so much for joining us, Nick.
No problem, Dylan. Good to see you again.
Lovely. Okay, so we'll jump right into it. And the first question is, Nick, could you explain the key differences between public and private healthcare in Ireland, and why a patient might choose one over the other?
Okay, thanks, Dylan. So there's two, I think, aspects to how you'd answer that question. The first is that we've got primary care and secondary care. So primary care basically is your GP services, and there's lots of community services then around that in primary care, OT, physio, and speech and language therapy, public health nurses. So primary care, and then secondary care is the hospitals. So the difference between public and private patients in primary care, going to your GP, patients can access GP services through the medical card system, and that's a system whereby the government funds the patient's care with their GP, and it's based on income limits. And depending on what your income is, you can apply for a medical card. And if you're over the income limit, then you would not be eligible. And then you have to pay the GP at point of service normally for a GP visit. So the income card, the medical card income guidelines are quite stringent. So for a single person under 66 living alone, the income limit is €184. So you can see that the income there is, I think, quite low for the threshold for a full medical card. However, there is also a thing called a GP visit card, and GP visit card, the income threshold for a single person under 66 living alone is €304 per week. So the difference between the two cards is basically a full medical card will entitle you to your GP visits and your prescriptions, whereas the doctor visit card does exactly what it says on the tin, and you get a free visit to the doctor, but any prescriptions have to be paid for in the same manner as a private patient. So for your GP visits, you've got medical card, which can be medical card or visit card, or private patients. Private patients can also access some aids from the state or some payments from the state in relation to their care in primary care, and that the most popular one is the drug payment scheme. So the drug payment scheme is a scheme whereby patients who pay for their medications, that would be private patients or patients with a doctor visit card, they can apply for a drug payment scheme card if they or their family, so it's the full spend of the family, is more than €80 a month for approved drugs or medications, and also for some other things. For example, if you've got sleep apnea, the CPAP machine rental costs can go towards that €80, and the rental cost of oxygen can go towards the €80. So if you have a drug payment scheme card and you pay more than €80 in a calendar month, you will be entitled to a refund, or you won't have to pay more than that at the chemist, depending on the chemist that you attend. So okay. There would be the main differences in the primary care. And then in secondary care, we've got public and private hospitals. So public hospitals for patients with medical cards there's generally no fees for outpatient and inpatient care. And for private patients, there are some modest fees for inpatient care that I suppose that cap out at a couple of €100 a year for prolonged treatment. But so basically, the public hospitals are free for medical care patients, and there is a reasonable low threshold limit for private patients in the public hospital. And in the private hospitals, really patients, unless they're very wealthy, will need to have health insurance to access the private hospitals, because private hospital care does tend to be expensive, and there's a number of health insurance companies operating in the Irish market, and recommend patients shop around for the best value among them. The health insurance companies do sometimes actually pay a contribution towards private patients' GP visits, and again, these are specific to the individual policies. So basically, in summary, in GP practice or primary care, patients can have medical cards, doctor visit cards, or be private patients. And medical cards, patients have free GP visits and medication. Doctor visit cards have free doctor visits but pay for their medication, and the private patients pay both the doctor and pay for their medication, although there is a drug payment scheme that means the most any one family should pay per month for their medications is €80. So I hope that's helpful.
Very good. And I suppose, essentially a quick differential between each one in terms of why a patient might choose one over the other, barring financial restrictions, essentially, so if money wasn't essentially the object here.
Well, I suppose it's the eligibility for them is the main criteria. That if the patients are eligible by income, they can get the medical card or a doctor visit card. So, in general, most GP practices would have both medical card and private patients. So the doctor you're getting to see is the same doctor, and the quality of care should be the same for medical card and private patients. There are some private practices only, and we've seen over the last number of years that capacity and access to general practice is an issue. There is now very difficult to get same day or even next day access to the GP, and lots of practices it's within a couple of days or a week that you get to see a doctor. And in those situations, I do see these patients with medical card opting to attend private providers. They could be private bricks and mortar in-person GPs or private providers online, and certainly at Get Healthcare we would have both public and private patients who access the service, although there is a fee for everybody, so that the online services are medical card does not make you eligible for those, but we do see medical card patients who opt to pay the fee because of difficulty in accessing their bricks and mortar GP.
Very good. Okay, so what are some common misconceptions Irish patients have about accessing GP services, especially for online platforms like gethealthcare.ie? So I suppose starting off with the traditional bricks and mortar, any misconceptions there, and then expanding into online.
I suppose some patients think that they once they have a GP that they can't change. They're aligned to that GP for forever, but it actually is both medical card and private practice systems allow for the patient to choose their doctor. So if patients want to change doctor, they can. And I think sometimes patients think that because they have a medical card or because they attend private, they pick their GP, they can't change. But that isn't the case at all. They can, of course, change. And even when a patient is a patient of an in-person GP, sometimes they think that might prevent them from consulting with an online GP. But of course, the two positions or the two services are not mutually exclusive. You can always attend an online GP, even if you have an in-person GP. And if you want, you can request the online GP to send a summary of the consultation to your base GP or to your bricks and mortar GP. And the online GPs, especially at Get Healthcare, we're very happy to work in cooperation with the traditional GP model and to share information for the benefit of our patients, so that everybody has the available data and that continuity of care can be facilitated. It also works in person. As patients consult with us in the online space and at Get Healthcare with I suppose problems that they don't want to talk to their own GP about, and so they won't want that shared. That's okay as well, because it's absolutely the patient's choice about how their information is shared.
Okay, very good. So it's information sharing essentially would be like the most common misconception, and then the ability to chop and change between GPs as required, and I suppose then the ownership over all your own data is probably the most important one.
What I would say for people though is that the more your doctor knows, your doctor service knows you, the better things will be. So to have maybe a preferred online provider like Get Healthcare, and maybe have a preferred in-person provider, which in some locations can also be Get Healthcare, but that you're better to stay over a period of time with one service. What I'm saying is that if you're unhappy with that service, you can change, but I'd advise people against having 6 GPs. That wouldn't be a good idea, just from the point of view of, you know, continuity of care and best outcomes. Patients do better when they're with one service that knows them well, and that can be online, like Get Healthcare, or it can be in person, or it can be one of both, but I wouldn't encourage many providers.
Okay, very good. What are some of the biggest challenges Irish patients face in getting timely healthcare, and how can they navigate these issues? So,
Look, I think when it comes to timely care, access is the issue. Okay, so as we mentioned earlier, there's very few GP practices in the country now that can offer same-day appointments or next day. Understandably, if you have a sick child at home, or you're a sick elderly relative, or sometimes when you're sick yourself, you don't want to wait 24 hours. You don't want to wait 48 hours. So access can be an issue because the system doesn't have enough appointments every day for the patients that need them. Well, the in-person system, and that's again where the online providers can come in very useful. Get Healthcare, we have same-day appointments. Patients can access the same-day appointment, and very often the episode of care can be dealt with safely and competently with the online appointment. And where that's not possible, where we've reached the ceiling of care online that needs to be converted to in-person, at least the patient knows then that they do have to go to an in-person out-of-hours provider, or they do have to go to the hospital, because as much as can be done safely online has been done safely.
Okay, very good. Can you walk us through the typical process of using an online GP service like gethealthcare.ie and how it compares to visiting a GP in person?
You might be better placed than me to do that. I can speak for how it works when the patient gets to consult with the GP, but I think that this question probably is more about accessing the service. So if you want to talk about how the website works and access that.
So accessing the website is relevantly easy and straightforward. So it's gethealthcare.ie. You go to the URL, you choose essentially which methodology you want to interact with the GP, which would be either via form fill, phone call, or video call. In time we will launch an in-person service, and hopefully in time we'll also launch a text with a GP service, which I think will be a nice function. You truthfully provide all of your details, so details about yourself. So we'll need to have we'll have to do a bit of KYC to find out who you are and verify that you are who you're saying you are, and then you're adding a layer of I suppose your initial medical requirements, essentially a description of what you currently need, and then truthfully filling out that form, and then booking an appointment, paying, and then a GP then will visit you. So I suppose the difference from a financial perspective is that you're essentially prepaying for the entire experience before you book or before you get the service, whereas with an in-person GP, or sometimes you're paying a deposit or you're showing up and you're paying afterwards, but you're essentially prepaying, and you're providing a lot more information before you actually meet with the GP, either via form fill, via text message system, via phone, or via video call.
Yeah, no, that's great. Just for anybody listening that that's not familiar with Dylan's 3-letter acronyms, KYC is know your customer, but I think Get Healthcare is KYP, know your patient.
Yes.
And there is that as Dylan described about you have to put in your personal information, and we do need to verify that personal information with a form of ID, so that we know the patient requesting the service, if the patient is going to get the service. And then after you follow the steps that Dylan has described, and your appointment is confirmed with the doctor will call you on phone or video call, whatever has been agreed at that time, and then a fairly standard consultation will proceed. In general, they last 10 or 12 minutes, or appointment slots are every 15 minutes, and doctors do need at the end of an appointment about 3 minutes to do some housekeeping and make their notes and arrange any follow-ups or whatever else needs to be done before they go on their next call. So you can expect the call to last 10 or 12 minutes. If you think it needs longer than that, you probably need to book 2 slots, but that is possible as well. And it's very, once you get to the stage where you're talking to the doctor, it's very much similar to talking to a doctor in a clinic, with the limitations that come for examination. So that's basically it.
Okay. What role does preventative care play in the Irish healthcare system, and how can people prioritise it in their daily lives?
So that's a really good question. And when it comes down to preventive healthcare, what I'd say is that the healthcare system, even though it's called a healthcare system, is designed to pick up illness. So traditionally, medical care and private patients came to the doctor when they felt unwell, and doctors and nurses are trained to assess the symptoms and examine the patient and produce a likely list of differential diagnosis of ill health, what might be wrong.
Yeah.
And then to put a treatment plan in place. So traditionally, the Irish healthcare system is designed to meet the needs of those who are unwell, and that's really important. Over the last number of years, there has been some change, particularly in the medical care system, about introducing some screening visits to try and pick up patients who may be at risk of being unwell before they become unwell. So there is, I think, an opportunistic case finding and preventive programs now for medical care patients. But basically, what patients need to think about in their, I suppose, in remaining healthy, which is what the question is about, is think about their risk factors for becoming unwell, and then to control these risk factors as much as they can. So we call them modifiable risk factors. So your modifiable risk factors will include your weight, your blood pressure, your blood sugar, your exercise, do you smoke or not. So these are all modifiable risk factors. And when people come for a checkup with the doctor, really what they're asking is, will you please check my modifiable risk factors? And if there's anything wrong, then we can assess that. So is the cholesterol high? Is the blood sugar high? Is the blood pressure high? Does the patient smoke? Are they overweight? Are they exercising enough? How is their diet? All of those things we can change. And so preventive healthcare really needs to be focused on maximising those modifiable risk factors that we know about, to give the patients the best chance of having long and healthy lives. There are also non-modifiable risk factors, so there are things like your age, your sex, and your family history. So if you have a strong family history of heart disease, well, you can't change that. If you have a strong family history of cancer, you can't change that. So preventive healthcare really is around identifying modifiable or changeable risk factors and ensuring that they are as optimized as possible.
Very good. How can Irish patients ensure they're making the most of their GP visit, whether it's online or in person?
Was it Roy Keane said, fail to prepare, prepare to fail. So prepare for your visit. So you'd be surprised how many people come into the GP visit and they haven't really thought about what they want, or they haven't really thought about what's wrong. And so that's the main thing I would say, is that before you come in, what's the main reason that you're attending? Is it that you have a cough? Is it that you feel tired? Is it that you're getting up at night to go to the toilet? What is the main reason? And get that out early in the consultation, because your consultation is time limited, right? It's 10 to 15 minutes. As you said earlier, it's probably between 10 and 12 minutes really, because the doctors need to have some time for housekeeping and note making and referrals and everything that goes on outside of when the patient is there. So the patients, I would encourage patients to be prepared. Lists are helpful from the point of view of knowing what you want sorted, but be aware again that if you have more than one or two things on a list, in 10 or 12 minutes, it's very difficult to deal with it meaningfully. So a list of 6 things, 2 minutes per item, you're not really going to get any quality assessment on any of those things. So the main, I suppose, thing I would encourage patients to do is to reflect on the main reason why they're there. Get that reason out early in the consultation so the doctor can assess it fully. And if there are other things, be prepared that they may not be dealt with on the day because there's a time limitation, and make sure that those things are not as important as the main reason for attending the doctor. Get the main reason out, get that sorted, and if you need to come back another day for the other things, well then so be it.
Okay, very good. I probably fall into the category of over-preparing before a GP visit.
Over-preparing.
Maybe too long lists, trying to squeeze it in. What are some common illnesses or health concerns that you frequently see in your practice, and how can patients prevent or manage them?
Well, this is definitely seasonal. So this time of year, colds and flus, chest infections, tummy bugs, this time of year that they would be the main ones. Then we have in the summer, hay fever, sunburn. Is there anything else for the summer? Yeah, so it's very seasonal, really, to be honest. But this time of year, definitely it's cold, flus, chest infections, tummy bugs, people being sick. And what we do see is that the more frail somebody is, the more likely they are to become unwell with those what can be sometimes minor conditions. But if somebody is predisposed to becoming unwell with them, they become really unwell. So our elderly populations, and sometimes they're very young as well, or those people who are compromised from maybe cancer treatment or other medical treatments, they can become really unwell with these infections that are minor for other people, right? So so seasonally we get infections in winter, and we get hay fever in summer, and other things in summer.
And in terms of preventing or managing, I suppose it's different, varying, but I suppose preventing and managing the most common ones. Any tips for prevention?
Oh, well, hand washing and masks, I suppose, but hand washing is the main one. We don't wash our hands enough, and so important, every time you go to the toilet, clearly wash your hands. If you've been out and about, you're coming home, you're preparing food, wash your hands. So washing your hands really is the main one. If you sneeze, blow your nose, wash your hands afterwards. Cough etiquette, sneeze etiquette. If you're using paper tissue, throw it away afterwards. Wash your hands. If you don't have it, sneeze or cough into your shoulder. They'd be the main ones. But I can't emphasize how important hand washing is for the prevention of the spread of communicable diseases. And if somebody is unwell and they're going to the doctor and they have got a flu or they have got a chest infection, they really should wear a mask, because it stops them or helps to prevent how they spread the illness. And when you go to the doctor, you could be sitting in the waiting room next to a healthy elderly person who's in for a checkup, and if you've got the flu and you're not wearing your mask, you may give them the flu. So hand washing and masking, wearing your mask for respiratory illness, I'd say, are the big ones.
How does gethealthcare.ie address urgent medical needs, and when should patients consider visiting a hospital instead?
So it's a really good question and very important, and there are guidelines on the website before people book. But if you've got chest pain, if you've got any serious injuries, and a very young child under the age of 1, if you've got any, say, weakness of an arm or a leg, or facial asymmetry, or problem with your speech, that might be a stroke. All of these are urgent emergency type symptoms that need to be seen urgently in an emergency department. So if you're in doubt, you could consult with an out of hours doctor service, but these type of symptoms or these types of presentations are unsuitable for online doctors.
Okay, very good. Yeah, that's and we can, like, if we come across someone who it's not suitable, we clearly signpost them to go straight to the hospital, essentially, as well, which is a good backup there. What advice would you give someone who feels hesitant about trying an online GP service for the first time?
What I'd say is, if you're thinking about it, maybe you should I'd encourage people to try it. It's accessible, it's convenient, you don't have to leave your home, you don't have to leave your workplace. Generally, it's more affordable than an in-person visit, and the quality of care is very good. And our doctors at Get Healthcare are trained at where a patient's presentation reaches the ceiling of care, which can safely be provided online, and they either need an examination or a test, for example a blood test, that they'll advise the patient they need to convert this to an in-person consultation. So it's very safe. The doctors are aware of the limitations that the service can provide, and I'd encourage people to try it.
Okay, perfect. All right, thanks so much for your time, Nick. If anyone has any questions or wants to reach out to us, it's info@gethealthcare.ie. You can follow us on socials or pop us an email. Okay, thanks so much for your time, Nick.